Welcome everybody, and thank you for joining us today for our second webinar in our three-part series. My name is Candice Aiken, and I joined the Safe Staffing program in July last year. I've been working within the ELC sector to prepare for this enactment. Also supporting our sector and on call with us today is Joanne Duncan, who is on secondment from the inspection team and will be supporting throughout the webinar. Today, I am using the online platform AHA Slides again, which allows the presentation to be interactive. If you could please scan the QR code now to access the slides. And this will allow you to interact with the presentation and take part in our polls and questions that we'll be asking throughout today. Joanne will also put a link in the chat for anyone who doesn't have access to another device or an ability to use the QR code. Next slide, please, Joanne. So before we start, I just wanted to go through some housekeeping for the event today. Today's session will be no longer than 1 hour. We are recording the webinar, so again, please keep yourself muted to avoid any interference. And finally, as we do have a large number of people on the call, we'd be grateful if you held any queries or comments towards the end. We will be giving you an opportunity to fill out a Microsoft form. Joanne will be supporting by entering links throughout the chat with regards to references of the slides as we go through the session, and this will just make sure that everybody's able to access the links required. Thank you. Next slide, please, Joanne. Before I start, I just wanted to ensure, we've got some people already doing the poll. Thank you very much. As you know, we are a commissioned program from the Scottish Government, and we do have data to provide, which we'll be gathering through 2 polls. We'd be grateful if you could support the first poll before we start, and we'll ask the same question at the end of today's presentation. I'll just give everybody a second to click on and make sure the responses are working. I also wanted to confirm that this is not a judgment. This is more about the impact of the presentation so we can see where the sector are with getting ready for enactment. That's great. I can see everybody accessing it. Thank you very much. Joanne, if we can move on to the next slide, please. Thank you. In part 1, Joanne gave an overview of the whole Health and Care Staff in Scotland Act 2019, which will be enacted in April this year. If you have missed part 1, you can find the recording and the presentation slides on our ELC Hub page. Today's session has been developed to dig a bit deeper into the main principles of the Act. The session will be a little bit different from last week and very interactive. The answers are going to come from you. You are the experts, and I'm here to facilitate and guide the session. Now, I do understand the pressures on the sector when new guidance or legislation is released, and I'll work with you today to identify strengths in the sector and work with what you already have to meet the expectations of the Act. I hope that you will be leaving today feeling a little bit more informed and prepared for enactment. We are spreading these sessions out to allow for reflection in between each session. Any questions and queries will be incorporated in the Q&A session at the end of the 3rd webinar. Next slide, please, Joanne. Thank you. So let's jump straight in. Part 1A gives the foundation of the Act and tells us about the guiding principles and why it's important within social care, which we touched briefly on the first presentation. The Act states that the main purposes of staffing for the health and care services is to provide a safe and high quality service and to ensure those best outcomes for people using the service. The rest of the Act is all about making these main purposes happen. Services should be able to discuss how they've considered these guiding principles and use them when making decisions about staffing. Next slide, please, Joanne. Thank you. In part 1B of the Act, we find the 8 main principles, and these must be considered when arranging staffing in any service type in order to achieve the main purposes set out in the last slide. Your inspector will be looking at these holistically and open up discussions on individual areas if needed. For the purposes of today's session, we'll go through each principle individually to ensure there's a deeper understanding of each principle. Many high-performing services will be meeting the requirements of the Act, and part of the webinar today is to support you to identify your strengths. Then use this information as a reflection on how you can make improvements moving forward. We will ask you to use the AHA slides to share your strengths currently in your service and ask you to keep bringing it back to staffing. What staff may need or do to ensure they are meeting the expectations of each principle. Then once you've contributed to the slides, I'll share some considerations you could use moving forward and linking them to current guidance or documents. So let's jump into the first principle. Next slide, please, Joanne. Thank you. So improving standards and outcomes for people. Principle number 1. The emphasis should be on identifying how standards and outcomes for children using services can be improved. What currently are you doing in your service to support your staff to improve these standards and outcomes for children? Next slide, please, Joanne. So I'm going to give you a moment. I'll be quiet just to gather your thoughts, and if you could start interacting with the AHA slides, and then I'll read them as they come on. I see people typing. Thank you very much. Professional learning, training, staff training, that seems really important to the sector. Wellbeing check-ins, absolutely. Personal learning plans and supervisions. These are all very important. I see a lot of people put an emphasis on training, which is fantastic to see. Development time, providing the opportunity for your staff to have that development time is vital. Regular staff meetings, yes, bringing everybody together so you have that shared vision. Absolutely, that's fantastic to see. Mentoring programs, these are some really good examples. And as you can see, there's 7 pages of answers already, which is absolutely fantastic that the sector has these answers. It's just about relating them to each principle. This is absolutely fantastic. 4-day working week is an option. That's fantastic. And that's really identifying the well-being of staff and if that's working for the people and meeting their needs as well. Professional conversations and dialogue, being able to work together and have those professional discussions is very important to meet the Act. Thank you. Chances to, just having a wee look. Self-evaluation, absolutely identifying what your strengths are. And this is part of self-evaluation and identifying the areas where you can develop and working with your staff team. These are all very important, but bringing your staff into that self-evaluation process so they identify what is their role to improving those standards and outcomes for children. Appraisal systems, well-being checks, inductions, got some great examples. Wow, can hardly keep up with all the good work out there. Thank you so much for sharing. Building positive relationships, absolutely. Positive relationships with families, with your colleagues, with the management team, all very good examples of how you can be improving those standards and outcomes for families. As I said in the previous slide, a lot of these principles are holistic, and you'll see as you go through, a lot of these answers will be covering multiple principles at the same time, and I'll try and remember them and bring them in as we go through them.
Care just to bring in some comments, sorry Candice, I just want to bring in some comments from the chat, because there's a lot of people commenting in the chat, so thanks for that as well. They're talking about regular staff meetings, wellbeing policies, open door policies between management and staff, and spaces to speak with one another as well. There's some team building events, play monitoring, more regular staff meetings and check-in with staff wellbeing. So just to make sure that these comments are captured in the webinar as well. Thanks, Candice.
Absolutely, I appreciate that, Joanne. Please jump in if I miss anything. Thank you so much. People are still typing. I can't believe this. This is absolutely fantastic. Ongoing reflection and evaluation processes and practices, recording to service users and feeding back to them. Absolutely. Thank you very much for sharing that. As you can see, there's so much great work going on into the service, and I really hope you move away from today's session thinking, oh, I know how to meet this principle. I know what we're doing well, and maybe pick up some ideas of what you could do moving forward as well. Training control of budgets, weekly meetings, well-being check-ins, regular staff meetings to discuss and share new information, participation in working groups. Absolutely. Thank you so much for sharing these. Joanna, when you think we've covered a lot of them, please move on to the next slide.
I'll just scroll down them, Candice, to make
Of
sure
course.
that this can be recorded in the webinar. People are asking if we can share this feedback. So this webinar is being recorded, so all of this information will be able to play back to you. So I'll just continue scrolling down just to make sure that everybody's voices can be heard. And if another point on the chat was for support and supervision as well. So staff support and supervision to support them to improve standards and outcomes for people. So thanks again for those contributions in the chat as well.
Absolutely. Thank you very much, Joanne. I'll see if I can pick up any value in staff. Absolutely. It's so important when your staff are feeling valued and appreciated. They're more available to improve those standards and outcomes for children. Understanding neurodiversity, absolutely, and valuing what they're able to bring to the team. It's really important to have skill mix that support individual children that might be thinking things from a different way, for staff to be able to come and be creative with that. That's fantastic. Thank you. I've never been on a session we've had so much feedback. So it's great that the sector is feeling so confident to share these, and obviously feeling really more prepared as we move towards enactment. That's great. Thank you, Joanne. So this is the section where I talk about some of the things that you can be having or consider moving forwards. So the safer recruitment through better recruitment guidance helps employers to ensure that the right people with the right skills and values are recruited into the roles. And this relates to 3.14 of the Health and Social Care Standards. Policy should be fair and comply with legislation, which helps leads to a positive experience and outcome for children. Consider your development and review of your recruitment policy. The National Induction Resource recognizes that most important driver of quality provision is a dedicated, highly skilled, and well-qualified workforce. This supports for employees as well as employers. This is a great resource with additional links and information. The National Induction Resource supports reflexive practice for everyone and can be used as an ongoing basis. Induction doesn't need to be ticked and done and put away. It can be revisited. Now, 1.3 of the quality framework highlights the importance of staff having the knowledge and interaction skills so children are involved in their learning and development. Some considerations for 4.2 could be a mentor and peer development, which was mentioned in your feedback, as well as something you've spoken about, CPD and development plans. Thinking about the current gaps in your team, your skill mix when considering new staff, for example. So as you can see, a lot of my considerations are things that you've already brought up, which is absolutely fantastic. We can move on to the next slide when you're ready. Thank you, Joanne. So principle number 2, take an account of people's needs, abilities, characteristics, and circumstances. We all know that no two people using a service are the same, and the outcomes that matter to the individual people may vary. Care service providers need to ensure an holistic, child-centered approach, which involves children using your service and the responsible adult as appropriate, in decision-making about meeting their individual needs. So if Joanne will move on to the next slide, again, I'd love to hear all the great work that's happening in the sector and how are you taking account of people's needs, abilities, characteristics, and staff and circumstances. And think about your staff in this role. Personal planning is the main one that's jumping out at me. Detailed personal plans. Personal risk assessments, very interesting. Thank you for sharing that. Staff responsible for their level of development. That's an interesting one. I like to hear about that and building that autonomy within the staff team. That's fantastic. Go-fit plans, well-being check-ins. Is that wellbeing check-ins with staff, wellbeing check-ins with children? I'd like to hear a little bit more about that, if you wouldn't mind sharing that. Wellbeing needs assessment, support plans, all about me, care plans, ASN plans. Absolutely. These are fantastic chronologies, really looking at the child as an individual and making sure off the floor time every week for the staff. That's fantastic. So that allows them to work on their plans, their PLGs for the children, and taking that moving forward. Thank you for sharing. Regular meetings with parents and carers, absolutely so important to get them involved and get their voice. They know the child the best, so that is fantastic. One-to-one meetings with parents prior.
We've got some home visits as well on the chat.
Fantastic.
Some staff appraisals, inductions, key worker meetings with parents, my world discussions and reviews, various interventions as well, talking about reaching out to other professionals and risk assessment. In fact, one of the contributions on the chat as well.
Fantastic. Look, we've got 9 pages of evidence already. The sector is on fire. Thank you so much. This is great to hear. Relationships, very important. That's a strong theme coming through. Communication and risk assessments. Allergy plans and medical plans, absolutely. The staff being aware of them, keeping them up to date, sharing that information for new staff or agency staff that might be coming in to support. It's all about the staff knowing this information so that they are able to provide that personalized care for the children. Through care plans, meeting with parents, observations of children, and reflecting on these with the children. That's beautiful to hear. Yes, absolutely. The children's voice and participation in this, meeting their individual needs, fantastic. I'm just trying to keep up with all of this. Great, 11 pages worth of comments. Open and effective communication, processes with the team around service users and personalized planning, absolutely. You've got Shinari, the wellbeing indicators in there.
Got good relationships with families on the chat here, sharing information, open communication. Somebody's mentioning focus observations.
Okay.
Robust transition programs.
Absolutely, very important. Regular consultation with parents, care plans, enrollment and induction. Absolutely. That's such a good way to capture a lot of information about the child, their home life, and start building that relationship with the family right from the start. Use staff strengths to develop areas and share expertise. Absolutely so important about looking at your skill mix of your staff to ensure that they're meeting the individual needs of the children. Recording and listening to parents with regards to information about their child, really valuing that. Absolutely. And visits, yeah, we've got care plans, GoFIC, appraisals and reviews, celebrating strengths and also providing support for staff. Absolutely. Building that capacity in your team so they can move forward to meet those individual needs of the children, and identifying areas of development together. Anything else you can see, Joanne, that I've missed?
There's just a comment there about any additional access required, resources required, sorry, and somebody's also agreeing with that on the chat, multi-agency working, and relationships and care plans, and there's more people having home visits before children start their speaking.
And I see a good one here about having additional access to resources for children. So hearing loops or any information or any additional physical support they might need to be meeting their individual needs. And ensuring the staff are well trained and prepared to support the child to use these additional resources is vital. Working with other agencies, again, one of the principles is multidisciplinary working, and we'll bring that again into principle number 8, but just to show to you how this links, because that's very important, absolutely. Another one, welcoming outside agencies into the setting to support children and families and working well with them. Staff knowledge, settling in process, again, we spoke about that, very important to capture that and start building that relationship from the start.
Just a comment there that's, sorry, that said passports for temporary staff, and I've seen that working really well in a lot of services where they have a snippet of information that's really important to the flexible member of staff to really support their knowledge quickly of identifying children's needs and how they want to be supported. So there's lots of great information here. It all comes down to partnership working, doesn't it? And relationships, which again is something which
Absolutely, and I'll speak about that again. You know, personal plans are fantastic in place, but what processes do you have in case you have staff move in, staff off, or agency staff coming to cover? Online learning journals, interagency working, flexible sessions for children to meet parents' needs. That's a really flexible approach. And if you're able to support that in your service, that's a great way to support the family. Reduce paperwork.
Sorry, Candice. It was nice to see leadership skills as well coming in here. So people are identifying distributed leadership, so they're identifying that leadership and supporting all staff, like you mentioned, have that information important here as well.
Right, I'm just aware of the time. We do have 8 principles to go. So although I'd love to keep going, we maybe need to move on to the third principle for to my reflections before we move on to the third principle. Thank you, Joanne. So you spoke a lot about personal plans, and that again links to the health and social care standards of 1.5 and 4.27 for personal plans. And some reflective questions for you are: how well are personal plans being used to improve the standards and outcomes for children? When staff move rooms, I spoke about this, to support an area, what processes are in place so that the person can see high-level messages? So Joanne mentioned brought in the passports, which is fantastic. Quality assurance from management is vital to ensure these personal plans are used effectively to support children and to meet their individual needs, abilities, characteristics, and circumstances. 1.1 of the quality framework talks about the pace of the day and looking at busy times, so that pickup, which is particularly a busy day, and staff want to be available to communicate with family. Do you have enough staff available to support the children during these times? To ensure meal times are safe and nurturing experience for children, one might think about when are staff taking their breaks, so that lunchtime staff feel supported, to ensure that they're not feeling stressed and able to meet the individual needs of the children. So you gave so much evidence there. This is just some reflective questions for you to take away to cover principle number 2. So we'll move on to number 3. Thank you, Joanne. So number 3 is respecting the dignity and rights of people. Children can expect to experience care services which underpin a human rights approach, where their rights are respected, protected, and fulfilled. Children are involved in decisions that affect them, informed of their rights and entitlements. So let's talk about how this is done in your service. We can move on to the next slide and you can share. Thank you very much. I see people writing care plans. Absolutely. You're in CRC. Absolutely. Fantastic. Thank you very much. Lots of people, children's voice. Absolutely. As Joanne scrolls through, I'll talk through 1.1 of the health and social care standards. Think about value in staff in this setting. And the UNCRC relates to 1.2 about the children's rights. Knowing families well, absolutely. Care plans. Staff knowledge. We're speaking a lot about the UNCRC, which is fantastic. Truly listening to the children's voice and where you go with that. You've captured that children's voice, absolutely. And then how do the staff use that to improve their outcomes? Responsive planning, absolutely. Children treated equally are listened to. Yep, fantastic. Children's focus groups, I love that. Is that to make improvements and assessments within the setting? That's a really interesting one. Giving children genuine choices in their play. Anything on the chat that I'm missing, Joanne?
Lots of more great evidence in the chat as well about children's voices and learning. People are saying it's coming back to the ethos of the service as well, which I would absolutely agree with.
Absolutely.
Respecting children's views and opinions. Inclusion for all was obviously one respecting the rights, but also embedding them in practice. Absolutely, that's a comment there that's really vital to just have a quick discussion about. It is about respecting the rights, and all of this information that the ELC is great. It's then how are we supporting our staff to understand their responsibilities and how they can make children's rights real for them. And that's been done really well in a lot of services.
Emotional check-ins for children. I see this as a theme because it came through in principle number 1 as well. Policies and procedures, absolutely, making sure that's underpinning, as Joanne said, the ethos of the setting. Key workers doing personal care, children's voice. Children's Council having a voice in how we can help to facilitate that. Absolutely, it's vital. All children have a voice, but it's about the staff's role in facilitating that and really valuing it.
There's more about children's committees on the chat as well, and that's done really well in a lot of services. Out of school care services do this really well as well. So if you do have comments within the school services that you can lean on and ask a little bit more if you're looking to promote that children's committee and children's focus group, and please do your comments.
Celebrating achievements as well. Yep, providing activities to develop their understanding. We'll just take one more page, I think, and then we'll need to move on. I am aware that we only have an hour and there's so much great work to discuss. So thank you very much for sharing all this information. Protecting children's well-being, child protection, absolutely. Thank you very much for sharing that. Linking with other services and schools to share rights ambassadors and promote rights, respect and ethos. Linking to the health and safeguarding and including early protective messages. Thank you very much. Staff consistency, absolutely. And again, you can link that back to personal plans as well. If you're talking about knowing the child, protecting their rights and their dignity, their personal plans brings that in. If you know that child, if you have that information, staff are better equipped to respect their dignity and their rights. So if we could go on to the next slide, please, Joanne. Thank you.
Just pick up one more comment, sorry, from the chat, just to make sure that that's recorded in the webinar. Understanding and respecting children's culture and first language is not English, and environments which are well thought out with consideration given to quiet, calm spaces. So that's really contribution to the chat as well.
Thank you, Joanne. So the next slide, I mean, you touched a lot of the things I've spoken about already. I just want to elaborate a little bit more. So 1.2 of the Health and Social Care Standards speak a lot about the children's rights. Some reflective questions for you is, what can you do to actively support staff to understand and respect children's rights? How professionals make rights real is a great resource to support you and your team. And Joanne will pop a link into that website for you. One example we've been using for 1.1 of the quality framework is nappy changing and toiletry interactions, nurturing and quality time and staff numbers to support this quality interactions as children aren't feeling rushed. Thank you, Joanne. Quality observation, someone already mentioned that, and staff training and development. In 2.1 of the quality framework, children's development and responsive planning is discussed. Children's confidence and staff roles, actively encouraging and supporting children is so important. And you can be thinking about staff training, knowledge and experience to fulfill this principle. We'll move on to the next slide, please, Joanne. Thank you. Number 4, take into account the views of staff and service users. Care service providers must be able to demonstrate how the views of people who use the service and those working in the services are being gathered and how they inform decision making moving forward. So we'll just go on to the next slide. Thank you, Joanne. As we work through these principles, you'll see a lot of common themes and how evidence, again, can cross-reference and look in this holistically. So it's okay if a lot of the same information comes up. So you're using surveys, Microsoft Forms, questionnaires, family feedback, voting boxes, self-evaluation, absolutely so important. And having that leadership at all levels. So self-evaluation is pulling in the whole staff team and understand their role in that evaluation and improvement. Floor books, daily diaries, mentoring systems, absolutely. Transition feedback, family feedback and evaluations, and gathering that information and really helping it to develop your service is so important. Staff meetings, seesaw, Lots of great ways with technology today to gather that feedback and have that interaction with your families. I'm curious what kind of things you do to gather the views and take account of the views of your staff as well. Peer assessments, fantastic. That's really building capacity of your team. Distributed leadership, absolutely. That's what I was talking about with the quality, the self-evaluation improvement. Thank you. Open afternoons, and so families can come in and you can continue to build that relationship with them. Feedback box, newsletters, weekly emails, staff feedback. Highlighting what we asked, what children and families said, and then what we did as a result of that feedback. So continuing that feedback loop, absolutely. So what did you do about that? Fantastic. Thank you. A mentoring program, open door policy. Nursery council meeting where staff and parents get together to discuss how they can make improvement. That's fantastic. That's a really inclusive approach there. Self-evaluation, parental feedback, floor books, phone calls, meeting face-to-face, absolutely pick up and drop off time. Surveys and questionnaires for staff, children and families, and other agencies we work with. So wow, so you've really taken it out to the third sector as well. That's fantastic. Okay, 9 pages of evidence here. This is absolutely brilliant work out in the sector. Evaluation and questionnaires and evaluating as a team to make improvements, absolutely. Lots of love going out to this principal. That's fantastic. Family engagement sessions, regular meetings, children's evaluations. Yep, bringing back in that children's voice. And that links to 2.1 of the health and social care standards and 3.1 of the as well. Anything coming up on the chat, Joanne, or are we okay to maybe move on to the next slide?
Yeah, just feedback forms, informal chats with parents, talking a little bit self-evaluation and actually how they're having an impact on the improvement, development and continuous improvement of the service. What they actually do with that information, what we say on the board here about, you said we did, so, and very similar to that, and we're talking about some meetings as well.
I love this one, empowering staff with making decisions about the setting. Absolutely, building that capacity. And that will link really well as we go into principle number 5, open door policy. So whenever you're ready, Joanne, we'll just move on to the next slide, but you can keep scrolling down. I'll just talk through it. So we spoke about gathering the children's voice. You'll already be thinking about how staff are enabling children to have that voice, and we discussed it a lot in the first and principle number 4. Is your team inclusive, and how do they demonstrate they respect those children's views? Looking at realizing the ambition and other tools to support children who may struggle to communicate or to be heard. And how are you supporting your staff to reflect on their skills in their quality interactions? Do they have the time and capacity to support and place value on these interactions? Now, by answering these questions and going through your own quality assurance processes, you'll already be evidencing this principle and building your own capacity and confidence as we get ready for enactment. We'll move on to number 5, please, Joanne. So ensuring the well-being of staff. Now, there is a link between the safety of people who use services and the well-being of individuals delivering the service. Increased well-being of individuals working in care services can reduce sickness absence, burnout, work-related stress, meaning they are available to care for people using these services. Healthy, engaged, and well-supported people working in care services are also better to provide a safe and high-quality service. An environment where people working in care services feel able to raise issues about the safety of people using these services, make mistakes, or discuss areas of concern is vital for their well-being. This involves creating a culture of transparency, continuous improvement, and open communication. An environment where it is clear to individuals working in care services that the relevant care service providers have a culture of system improvements rather than blaming individuals. Individuals working in care services need to feel safe to raise concerns at all times regarding any risks relating to staffing. Ensuring the well-being of staff is the biggest change with regards to this Act. In terms of staff well-being, the focus on staff well-being insofar that it affects the main purposes of providing that safe and high-quality service, ensuring the best outcomes for their service users. Now, I know many services are already doing this very well, and all the other 7 principles support you to ensure the well-being of your staff. So if we move on to the next slide, I'm really keen to hear what you're really doing out in the sector to support your staff well-being. We've spoken a lot about CPD. This will be supporting your staff well-being, building capacity and distribution leadership. I'll be quiet now to give you a moment to answer some of these. Laugh. I love that. A happy workplace, absolutely. Well-being days. Staff breakfast at all in-service days. That's wonderful. Coaching, well-being meetings, well-being days. I really do think the COVID-19 pandemic helped a lot of people identify the importance of supporting their staff well-being, and I really see a lot of things that were put in place during that time carry forward, which is wonderful. Staff mental health and well-being policy, absolutely in place. Staff meeting, fixed staff rotas to work around staff's own childcare needs. That's really inclusive. Social clubs, listening, team building fun days, staff nights out, confidentiality, absolutely. Ensuring staff feel comfortable to speak to you and that it's going to go no forward. Work-life balance, well-being check-ins, support meetings, open door policies, respect and value the staff and actively listening. Wow, that was really inclusive. Thank you. Breaks to recharge. Yeah, this is a really tough job. It's a fantastic job, but sometimes your staff just need a few minutes to gather themselves. Chocolate and cake. I'm in. Who is that? What workplace is that? In service days, regular meetings, open door policies.
We've got lots in the chat as well. Fostering an ethos of inclusion with supportive motivational leaders. Our open door policy and creating safe spaces for staff to relax, chat, and feel secure that they can actually help and give sharing and concerns. So lots coming in the chat, happy atmosphere, flexible working, thinking positive about the chats, and listening. And that's all that they've said, but I think that speaks volumes, doesn't it? Just listening to your staff.
Absolutely.
Recognising the achievements, being there for one another, room meetings, support for managers. I'm sorry I can't read them all out. I think I've captured the essence of that.
Yeah. I saw one that said birthday days off. That's one that speaks to me volumes. I'll definitely always take my birthday off. So if you're giving that to your staff, absolutely, they'll be making sure that they're feeling valued and in the workplace. Menopause policy in place, absolutely, really important. And making that normal to discuss and understand your staff's needs. Recognizing good practice, absolutely. Safe spaces. One thing I'd like to talk about is, you said safe spaces and staff breaks. Do your staff have a comfortable space to go to in their breaks? You know, what is your staff room? Do you have the facilities for staff to have a sit down in a comfortable environment to decompress if they need to? And that's something to think about. 12 pages of this, a lot of good work going out in the sector. Work-life balance, it's really important. Pizza staff meetings, absolutely. Empower and nurture, motivate understanding. And this is wonderful because we speak about all these words and terms when we speak about children, but it's important that we value in the staff and we have the same approach with them. WhatsApp chats, casual, weekly treats. So I'm just going to move on to the next slide. I think we've got a lot of this information, down to earth approach. Well done, celebrating staff. So when Joanne moves on to the next screen, you'll see some resources that are available to support staff well-being. I've already spoken about the National Induction Resource. Earlier Scotland has a fantastic wellbeing hub, which you can access to support as well. 4.3 of the Health and Social Care Standards talks about staff being respected and valued, and I really feel that when I'm looking at the AHA slides that you're sharing with us. Working with your team to develop and further their career is a way to keep them motivated. And please visit the Career Development Toolkit from the EESC. This will support you and your staff in moving forward in their learning and development. When you're covering 2.2 of the quality framework, you will be considering staff involvement in risk assessments and policies, and building staff's confidence in understanding their role. The expectations put on them has a huge impact on their well-being when they're at work. So we'll just move on to the next slide, please, Joanne. Now, on each slide, you may have noticed for each principle that I've put on the EESC Codes of Practice for the employer. As you know, these are already expectations on the employer. And here are some examples of the codes we thought were relevant to support the well-being of staff. Now, as with all the codes and guidance we have shared throughout this webinar, this list is not prescriptive or exhaustive. We think it's important to bring these into the session to provide you with a place to start and reflect upon. This is to support you to reach the desired outcomes and not to provide a prescriptive method. We'll move on to the next slide, please, Joanne. Now, fostering employee well-being is good for both the individual staff and the organizations. Studies have shown that there is a link between the safety of people who use services and the well-being of individuals delivering the service. Increased well-being working in care services can again reduce that sickness, absence, burnout that I spoke about, meaning they are available to care for the children in your service. Healthy, engaged, and well-supported staff are better placed to provide that safe and high-quality service. Working in early years can be challenging and complex, which means there is increased risk to staff's well-being. The legislation is looking for an environment with services to support their staff to feel able to raise those issues or concerns. This involves creating a culture of transparency, continuous improvement, and open communication. We'll move on to the sixth principle, being open with staff and service users about decisions on staffing, as well as taking into account the views of working in and using care services. Care service providers must be open with individuals about decisions on staffing. Care service providers should foster the development of an open culture, which allows and encourages those who work in the service to raise issues, to be supported in finding new ways to overcome risks without fear of adverse consequences. So we'll move on to the next slide, please, Joanne. So team meetings, rotas in advance, transparency, open one-to-ones, newsletters, clear policies. Policies are so important. Reviewing these policies with your staff on a regular basis, again, to build that confidence and capacity. Involve all staff so everyone's voices are heard. Daily check-ins, absolutely. Involve work trials, absolutely, yep. Staff meetings, seesaw, newsletters. Involving staff in strategic planning, absolutely. It's so important that they're feeling that they're part of what's happening in their service they're providing. And again, you can see how that links back to their well-being and their motivation. Ensuring all staff have the opportunity to read minutes of senior management meeting. That's very transparent, absolutely. Questionnaires for parents and children on what they value in their staff. That's fantastic, bringing that back into your team. Current and relevant policies, one-to-ones, parental feedback. Key worker choice for families. Yep, absolutely. And we'll speak about that in the next slide. Being honest, open, and transparent. Robust induction. Again, you can see how induction has come in and covered a lot of the principles. It's so important to have that solid foundation. Time in rooms. Involvement in improvement plans and evaluations. Good induction again. Headline news, information for parents about staffing changes in the playroom. Absolutely. Staff boards. staff shout-outs, interview candidates, spend time within the playrooms. Again, that is so important. See what they're like with the children, and if possible, get children and staff feedback as well about how that person has contributed to their session. Lots of thumbs up going for this one. This is absolutely fantastic. Children's feedback, staff involvement in interview process, visions, values, and aims. Absolutely. Honesty and good relationships. Yeah.
Appropriate support for disciplinary management and addressing concerns, consistency of deployment of staff across playrooms, a lot about communication, open door policy again to have those discussions, and somebody's doing a staff newsletter.
Oh, that's good. That's a new one. I haven't heard of that one. That's brilliant. We're in with a school, and we're involved in the whole school in service days, training, and email groups. That is really inclusive. That is fantastic to hear. When we speak about staff deployments a little bit more in principle number 7, I'm just linking it so that you can see how these principles link together moving forward. Children's questionnaire interviews, celebrating staff achievements, committee involved in interview and making decisions. Absolutely. Staff hub daily notices. Absolutely, making sure that this, if you have that capacity for having that little catch up every day, and that again can relate to the well-being and a check-in with your staff to see how they're coping. Committee involved in interviews, apologizing when necessary. Absolutely, we're all human, we all make mistakes. Peer reviews, we spoke about that in the previous one as well. Staff induction wall, absolutely. Morning huddles, a lot of the common themes coming through here. Joanne, are you okay to move on to the next slide? Have you covered everything in the chat?
And that can be a staff introduction wall as well. It's really nicely done in a lot of settings as well, just so that the children can identify who's going to be in the room on that day. So that's a nice way of viewing. And children as well, like any changes and stuff.
I'll just recap there because you broke up a little bit. It's just about making it visible who's going to be working in a room on any particular day, and if there's any changes, and just being transparent with that. So in 3.11, for example, of the health and social care standards, we spoke about key work, and somebody spoke about key work and children's and families' choice. So something for you moving forward is, how is this arranged and what factors are taken in place when you relate to a child's key worker? What processes are in place for children and families and staff too, to be aware of who's allocated to a particular room and area, for example? Are you looking at skills mix and what staff have a particular area to support the children to reach their outcomes in that room? Now, the Health and Social Care Standards 4.9 and 4.2 of the Quality Framework has expectations around recruitment and involving children. And I'm really happy to see a lot of people spoke about involving children and other stakeholders in the recruitment process. Education Scotland engaging parents and families are a great resource to further develop you in this area. So please have a look at those resources if you haven't already. We're going to move on to number 7 now, allocating staff effectively and efficiently. Staff arrangements should allocate individuals who work in the care service so that they have the greatest impact on providing safe and high quality service that results in the best outcomes for children in the service. It could include matching abilities and skills of individuals working in the service to the needs and choices of the children. And again, you can see how that links with the previous principle. So we'll go on and see what considerations you're taking when allocating your staff on a daily basis.
I'll just pick up on one final comment that came in there from the last slide, and that was support for managers. And that's absolutely right, because your staff as well. So where's that support coming from? Do you have good networks that you can lean on? It's a really challenging moment. So hopefully you have that support as well for yourselves.
Yeah, support for manager. I should have brought that up in principle number 5. When you're looking at well-being of your staff, you are staff, and a manager has such high requirements and expectations on them. So ensure that your well-being is looked after and what processes you have in place, what support you have. So looking at this principle, we look at daily plans for the team, rotas, spread the experience throughout the setting, appraisals and celebrating staff strengths spread across the service, skills of staff. Absolutely. Everybody's going to bring in different skills and their own experiences into your service, and really understanding your staff and allocating them to where best improves those outcomes for children, but also where they're feeling valued to improve their well-being. Skills and ability, mix of staff, consistent staff in groups, using staff strengths, experience. A lot of this you've already captured in these comments. How flexible working affects child attendance. Staff champions. When you talk about staff champions, again, looking at their interests and their experience and where they best fit to support the setting. Knowledge of staff. Look at the needs of the children in each room to match the level of staff required. Absolutely. Knowing staff well, their skills, strengths, and CPD needs. Knowing needs of children to ensuring the staff can meet their needs, and knowing daily routines and when staff are needed. Absolutely. That's really the essence. Fantastic. Ensuring trainees or apprentices staff are well mentored and working with trained staff. Staff communication consistently through their session, embedded to go with the flow with the children and the staff area and flexibility. That's absolutely great. We run with no supply staff or agency. Wow, that's really impressive. On show runs of the nursery, we introduce every staff member. Again, you're bringing in the families right from the start. Listen to the staff, knowing staff well and their strengths. Absolutely. So when we're ready, Joanne, we'll just go on to the next slide. Staff arrangements should allocate individuals who work in the care service so that they have the greatest impact. And you've really highlighted that in your slide. The health and social care standards 1.8, 3.15, and 3.17 of the standards. You'll already be looking at the needs of individual children, rotas, key worker allocations, and relationships. And you can see you've touched on all of that already. Considering the framework points here is 1.5 and transitions. At the end of the day, as well as moving rooms or settings, and how staff are managing these situations. Are staff able to support if needed, and is covered provided? In 4.1 and 4.3, considering the staff skill mix, and you've already brought that in quite a lot when setting up your teams or filling in your gaps. And looking at your rotas and allocating current staff in areas where their skills are best suited to support each other. And we'll move on to the last principle, which is number 8.
I'll just cover some comments from the chat for number 7 before we move on, if that's okay.
Yeah.
So somebody's mentioned about ensuring PVG and references are done as quickly and thoroughly as possible, which just shows you that's where your quality assurance checks come in with this legislation and how that can support this principle. And they're talking about maximising training of staff, respecting neurodiverse staff as well as come in, involving current staff with those children who are making the transition across the nursery. So looking at your transition policies, so you can identify how you're already policies and procedures that you have in place is going to support the areas of this legislation and using staff's individual skills and abilities accordingly with their staff strengths. That's what we built.
Thank you, Joanne. So the last principle today and for the Act is promoting a multidisciplinary service. And a lot of you touched on that already. So staff arrangements should promote a multidisciplinary approach and where it's appropriate to meet the needs of children using the service. So we'll jump straight in to hear what you're doing in your service because you're answering all these questions so well. We've got some people typing. So we've got inclusion policies, respect, multi-agency meetings, CPMs and IEPs, TAC meetings. Yeah, a lot of different local authorities will have different names, but it's the wellbeing meetings around the children. Inclusive policies, open door policies, effective communication. multi-agency approach and early intervention, stage intervention to ensure inclusion, GOFIC meetings, yep, updated care plans, very important, and sharing that information as relevant, inclusion, respect, and regular supervision, one-to-ones. And think about your staff's capacity in facilitating these multi-agencies approaches as well. Good communication links, mentoring, building good relationships, absolutely, professional relationships. And again, it's very important to have the children and parents and their positive relationship as well, so that they're involved in this at every step. Development of staff skills, yep, termly updating care plans, chronologies, good communication with parents. Can't keep up there, just streaming in professional dialogue, working with other professionals to support each other and their families. GOFIC plans, good relationships with inspectors. Yep. Staff and teacher open evenings with, yep, absolutely, respecting with relationships with other agencies and knowing where to access support for the families. So important. School nurse, learning support, counselor, EAL support in their school. Team around the child meetings. Yep, visits in ELC from partner workers or partner agencies. Again, we talked about the joint home visits, working with the health visitor perhaps. Quality improvement officer to support from your own authority. Lots of really good examples coming out here. Joanne, anything that I'm missing on from the chat?
There's people in the chat talking about mutual respect for all services as well, because we're all trying to get to the same outcome to support children and families, but actually how we might do that will be slightly differently. So it's about having that mutual respect and what are the drivers for the reasons that people are acting and how they are acting. And that does come down to building those relationships with external agencies to understand what their drivers are. Some people are doing home visits with leadership teams, and I have seen some services doing home visits with the health visitors. So they're starting with the early stages of developing those relationships and working with children and families together. And some other comments in the chat about additional support plans in place and that they're shared with staff, children and parents and carers. And unfortunately, I'm looking there about how including staff are in including the completion of membership.
Oh, there was one there about the training for individual needs to build staff's confidence, example, administration and administrating emergency care plans and medication, absolutely. And if we move on to the last slide, that's something that we were considering as well. Are staff aware of their role when working in a multidisciplinary team? And do they have the right training to achieve their best outcomes for the children and support to ensure their own well-being? It can be quite stressful for staff attending these meetings, if they're not feeling confident to deliver the message, or with the messages delivered to them about the child and ensuring their well-being is supported coming out of that. Again, you could be looking at the GOFIC 5 key questions to support staff to gather that information before meetings, and considering if staff have or needing any further support to answer these questions. How involved are they in the wellbeing meetings for the children? I think about speech and language to support children, for example. And do staff have the time to ask about additional strategies, reviewing and understanding these strategies to improve the outcomes for children? These are just some reflective questions, but there's been some great answers on there. So now we've come to the end of the 8 main principles. Moving forward, you can look at your own in-house policies, procedures, and processes. Reflect with your team to ensure that you have the right people in the right place with the right skills at the right time, and what you can do to improve upon to ensure you're meeting the expectations of this act. Now, I know we're coming up to 11 o'clock. I've only got a few more slides that I would like to share with you. Joan, if you could move on to the next slide, thank you. So we did mention in the first session there is statutory guidance which accompanies the Act. The guidance is still in draft form, however, consultation is closed and the final revisions are being made by the Scottish Government. On our ELC hub page, we have linked each principle to the statutory guidance. along with other documents you may use or consider to meet each relevant principle. You can find this when you go onto our ELC Hub Safe Staffing Hub page, and under Daycare of Children, you'll see the 8 principles. If you click onto the hyperlink, you'll find a PDF which looks like the one on the screen. And Joanne will put a link into our ELC Hub page, and you can go away and review that and share it with your team. Next slide, please, Joanne. So we are running in-person events throughout February and March, and you will be able to attend each of these. We are going to be there all day. However, the times on the screen for each area will be dedicated to support services in the ELC and children and young people sectors. If you'd like to come along to any of these in-person events and continue to build upon your knowledge and understanding of this new legislation, please register for the event that you'd like to attend. There are limited spaces, and as you can see, Glasgow and Edinburgh are already fully booked, unfortunately. Joanne will pop in a link into the chat for this event as well for you to register, or you can scan the QR code. Next slide, please, Joanne. Thank you. So we would be very grateful. Just take one moment, please, to support us in gathering our data and answer the final poll for today. I hope you are feeling a little bit more prepared with the expectations of the Act after today's session. Thank you. I see people engaging. I'll just take you another wee moment before we go on to our last slide. Thank you, everybody. Joanne, the last slide, please. So just thank you all very much for attending our second session today. And next week, we will use the same AHA platform to allow you to share areas of good practice related to Part 3 of the Act. And we'll be looking forward to hearing from you about the positive work out in the sector. If you haven't signed up for the session yet, we'll put a link in the chat again now for you to register. The QR code on the screen will take you to the Microsoft form, which we invite you to submit any questions or queries you might have about the Act. With such high numbers registered for each event, we don't feel that we have the ability to do a Q&A session after each session. And that's why at the end of Part 3 next week, we will be doing a Q&A session. You'll then be more than welcome to come along and come off mic if you feel comfortable and ask any questions during the session. We will collate all the questions from the Microsoft form and try to develop answers in themes just so that we can cover as many questions as possible. Thank you very much for taking part and joining me today. And Joanne, thank you very much for your support. The recording will be available on our Hub page as soon as we can, and we look forward to engaging in a more interactive session next week. Thank you and have a good day.